Good morning. My name is Sherelle Butler. I am a certified perioperative nurse working towards my Bachelor's of Nursing Science degree. I want to thank the United States Congress for taking the time out of their busy schedule to hear the concerns of the voting public. I am here today on the behalf of the opioid crisis in rural America. According to the United States Department of Agriculture, 64,000 Americans in 2016 died from some form of opioid drug overdose. And out of the 64,000, 34,000 deaths were in rural America. That is 174 deaths each day. In October 2017, the Center of Disease Control and Prevention announced that the number of deaths in rural America has surpassed the rates in our urban communities. In December 2017, a survey by the National Farmers Union, along with the American Farmers Bureau Federation, concluded that 74% of all farmers have been impacted by the opioid crisis in rural America today. According to the CDC, the opioid crisis that we're currently suffering from have left no corners unturned in America. The trickling down effects are damaging families, quality of life, economic opportunities, and rural prosperity. According to the United States Department of Agriculture, our agricultural growth and development has been impacted tremendously. According to the National Rural Health Association, heroin has become predominant in rural America due to the rising cost of prescription drugs, which increases the incidence of HIV, hepatitis C, and AIDS. There are many barriers to defeating the opioid crisis in rural Americas. These barriers consist of unreliable transportation, limited resources for first responders, limited amounts of drug therapy, motivation, the stigmatism behind the drug abuse, the lack of educational resources, minimum rehabilitation facilities, and providers. Poverty, lack of education for our healthcare professionals and the users in these rural communities, according to the National Rural Health Association. There's legislation to address these barriers. The White House Office of National Drug Control Policy of 2015 adheres to the public health approach to the opioid crisis by focusing on prevention, early identification, and treatment through recovery services that support long-term lifestyle changes. This policy also focuses on the reduction of harm by making naloxone readily available and by supporting needle exchange programs. I support this policy. But men and women of Congress, we must do more. As a nurse, it is my duty to advocate for rehabilitation centers that offers inpatient and outpatient therapy, more transportation to and from treatment centers, vast education for users and providers, more infrastructure to increase internet access to telehealth communication therapy, and an increase in first responders and medication therapy. In conclusion, I would like to take some time out and just tell you a small story. I have had a personal experience in 2018 with 19 patients that have died in rural Delaware alone of opioid overdose, where I participated in their organ harvest. There was a father of 5 children that came in and had his organs harvested. 2 weeks later, the mother of those same 5 children came in and had her organs harvested. This epidemic has left 5 children parentless. Members of Congress, we must do more. Thank you for your time.